Why are we coming together? Um, we're going to talk about what is Early Well, who is involved, why does Early Well even exist, our priorities for this coming year, and how you can get involved. Um, the Early Well Foundation or initiative, sorry, back up. Oops, sorry, hold on one second. Back up hold on, let me go through it, hold on. Stop share. Hold on one second. Let me figure this out. Sorry about that. Okay, we back? We good?
We're back. I do see the side.
Yes. So, okay.
There we go.
There we go. Back on track. So Early Well was founded in 2019 as a co-lead between the North Carolina NCChild, which is where I work, as well as the North Carolina Early Childhood Foundation. We are supported by a few grants, but what the mission of it is to bring families and organizations together across North Carolina who value infant and early childhood mental health. Um, we are here to support families. We have a coalition that we engage members who are in the mental health field, as well as family and caregivers. So part of it, I've been with NCChild since January. So part of it, hearing all these different coalition members, coordinating team, action team, took me a minute to get straight in my head. But our coalition is more of 200 individuals across the state who are interested in social emotional health of young children. We have pediatricians, we have healthcare professionals, early educators, lots of different folks who are working on this coalition as a bigger space. Then we chop it down to a smaller coordinating team who are the primary decision makers in our work. These members have been appointed. We have parent leaders on that. We have other mental health professionals, as well as state level mental health professionals. And then the advocacy teams are a self-selected group that advocate for policy and engagement. So we have two separate groups. So you can kind of see it as more like a triangle as you're looking at it. We this was determined obviously because there's so much more increased research between early childhood mental health, their beginning relations, brain growth and development, and knowing that we have early intervention system through the CDSA and what ECAC does, we know that early identification for children who have difficulties and their families can improve trajectories. So if we start therapies early, start that support early, we hope to work ourselves out of a job, really. But we're also trying to work on minimizing the silos and duplication of services that we see in our healthcare situation. So our public priorities are, and I'm going to go through them really quick. Well, let me know if you have any problems seeing that. Do you see that? Andrew, is it good?
I just see the slide.
Okay. I'm sorry, guys. Well, our policy, we have 3 public policies that we're going to be working on this year. And one of them, and hold on, I think I can get it. One of them is reaching families who have doula care, like for families who want to have doulas but are unable to pay for it. So they know through some studies there has been increased positive prenatal experiences by group prenatal care as well as having a doula involved. So one of the things that we're trying to work on is to have trained people who can support parents before birth and after birth to pay for through Medicaid system. That will give the parents choice of how to care for their baby. The other thing is, and there are some pilot projects going on in North Carolina about group prenatal care for parents who have other parents that they can talk to. That shows that they've built resilience to take care of themselves and their children. They decrease. It's been shown to decrease preterm labor and low birth weight and increase breastfeeding. So that's kind of a nice thing. So we want North Carolina Medicaid to ensure every pregnant individual utilizes Medicaid health insurance to access group prenatal care. This one's big. We're recommending that the state provides and increases the reoccurring $200,000 for Family Support Network, especially for those children who are and parents who are caring for children who have disabilities. The Family Support Network does a lot of great things in our community and across the state. One I really, really want to talk about, because this was kind of through the legislator, there were some questions about Reach Out and Read. And Reach Out and Read is a prescription-based program that supports literacy. So Reach Out and Read books are given to by medical professionals, and they model how to read the book and trying to create those meaningful interactions that are more than memory. They're fundamental foundations of cognitive, social, and emotional well-being. So knowing if you start reading early to your children, they're going to be lifelong readers, hopefully. So they're just wanting to make sure that the general legislator is still wanting to keep funding it. So that's a part of Early Well. These are some addressing the children's mental health crisis and supporting the child care workforce. This is one that we are looking at in the near future. This is more probably going to be in our longer session for the General Assembly, and talking about foster care. These two items will be addressed in the next session. So we're tabling those for next year. Okay, I'm going to go back to my PowerPoint. Okay, you guys can see my PowerPoint. So one thing that we are looking at for Early Well is how to get family leaders involved. So we are taking applications now for family leaders. We know that family leaders who have the lived experiences are vital to this Early Well initiative. We hope to get at least 8 to 10 more family leaders that will be providing leadership in their own community, but also helping NCChild and North Carolina Early Childhood Foundation in working together with different coalitions to be part of the Early Well campaign. So the Early Well campaign, just briefly, is to you meet on a quarterly basis. You also are paid. So parents who we value your work, we value your input. So that we are giving stipends out for families, and also getting good connections with other folks who are family leaders in their community. They also are looking for folks who are willing to talk to General Assembly, talking to their own legislatures, or providing some grassroots efforts in their communities. If you are interested, I'm going to send Andrea this whole slideshow, and I will also attach the application, the links to the application, as well as the Early Well policy priorities. And if anything makes sense or you have more questions, you're more than welcome to reach out to me. I put my email and also information about NCChild and North Carolina Early Childhood Foundation. Um, they are both great advocacy groups that want to change policy to make the lives of parents and children and families in North Carolina viable for the next generation. And having parent leaders is going to be our how we're going to be able to support you guys over the next generation. So I'm going to stop sharing.
I mean,
And I really appreciate what y'all have done. And if you have any questions, I'm happy to answer.
I was gonna ask, is there a deadline for that application?
Applications, thank you. Applications are due June 21st, and we might be extending that. So I will let you know about those applications. We will have after the deadlines pass, we interview parents to see if they are interested and what they have been doing in their own community of advocating for their own family.
Great. Does anyone have any questions for Aimee? While we're waiting to see that, I am going to launch our poll. So if everyone attending does not mind answering a few questions, the grants that we work on require that we report back to them of what we're doing is useful, relevant, and of high quality. So let me pull that up real quick. Okay, and if those that are joining us today could fill that out, that would be really appreciated. And also, if you have any questions, please feel free to put them in the chat or unmute yourself. Happy to take any questions. And do you have any parent leaders now? And if so, how many do you have?
Right now we have two.
Okay.
And you do not have to have a child with a disability. We are looking for families who have been active in their community for children birth through 8. That's our catch point for this early well work because it's early childhood birth through 8 years old is just the other stipulation. I will also say that our NCChild Parent Advisory Committee is taking applications too, and I will send those out. I will share that with you too, Andrea, so you can send that out to your network. And our Parent Advisory Committee is specifically part of NCChild, who is elevating the work of what NCChild is doing. This Early Well group is a totally different group of folks that have a wider net through the state, whereas our NCChild group is more of a smaller group, but we are hoping to add on both sides of those groups, adding eight parents on both sides. So total of 16.
Okay, great. And I think you just answered the question that popped up. Are you looking for family leaders with children who do not have disabilities as well? You said yes. Yes, you are.
Mm-hmm, mm-hmm. And knowing that parent and parent voice is so important, we like to have a wide range of people with different backgrounds and interest. So if you feel like you have some gifts to bring, or if you have a child that is outside that age range, but maybe you're a nurse, maybe you're a mental health therapist, maybe you are somebody who works for or on behalf of children with mental health issues and would like to join our action teams or our coalition in general, I also will send that to Andrea too.
Yes, and like Aimee said, we will be sending out all that information to everyone that's attended today. Are there any other questions? while we wait to see that, I do want to plug our next Tool Time Tuesday, which is scheduled for next Tuesday. We will have ECAC parent educator Carolina Hunter with us, and she will be talking about painting the big picture, which is one of the ECAC staff's favorite handouts that we use. She will be talking about that worksheet and how it guides each writer in describing their child and provides tips on what works best and what others can do to help them be successful. So it's a great tool for parents to have, especially when working with schools and, therapists and everyone too that helps your child. So are there any other questions for today? All right, if not, we will give you 10 minutes back to your day. And we appreciate Aimee joining us. Like we mentioned, we will be sending out all this information to you along with Aimee's email address. So if you have any further questions for her, you can reach out directly. I thank you for joining us today, and I hope you enjoy the rest of your Tuesday.
Thank you.
Thank you, everybody.